PICS stands for Primary Integrated Care Supports Program. The program is pitched at people with severe and enduring mental illness and people who are needing some support to get connected back to the services they need in the community, and particularly to transition them back into GP care. The PICS program works across an area called Central and Eastern Primary Health Network. We've got 15 credentialed mental health nurses and we've got 9 peer workers. So some of our nurses work from GP practices, but many of them are just out working in community organisations.
So having the mental health nurse and having the PICS support to be able to refer for that service is really important for the GP, and a lot of the GPs here love the program. Any opportunity that we have, if they're eligible, we will refer, and it's amazing. The mental health nurse sees our patients for an hour, sorts out all the nitty-gritty, and they get that personal support, which is fantastic. Oh, I think grab it with both hands. I think that it's a great opportunity to integrate mental health and physical health in your practice, and to not only do that but go the extra way to actually involve peer workers, because they are the key, I think, to really helping patients who want that lived experience to help them through their journey.
Yeah, working in the Sunnyhill medical practice has been a really good opportunity. Initially, I was aware the doctors were a bit uncertain as to what role I had and what we're going to be bringing to the clinic. But over time, just in having much closer sort of interaction with them, it's much clearer. So they're really appreciative to have someone with this sort of role and capacity. And it's mainly because they've got limited time, and they've got a lot of balls that they're juggling in the air. We can provide just a lot more intensive care with people, offer them more time and more follow through on things. The feedback I've got from people, they're very, very happy with it. They're appreciative of just having this extra support, people who they feel understand their situation and can advocate for them, and they reflect back that they feel like they do get a holistic, I suppose, coverage of things. We have that diversity and that flexibility to be able to sort of range out and assist them with lots of areas of their life.
It's really important to see a psychiatrist and a medical professionals, but you need a bit more practical help. I had to face it. I had to face the fact I was getting older. All these issues came up. Anthony listened and offered other practical help, and he also said to me, Fran, we've got a thing called peer support worker. And I'm not too sure what the time frame was when I finally met Jim, but he said, do you want to meet someone? And I said, yes. He said, do you want a man or a woman? And I said, I don't care, as long as they're nice. So Jim and I went and had a coffee, and I was being my usual distant self because I was protecting myself from people. Admitting what I was really state I was in was getting I didn't want it to be happening. Jim has been very patient and he's listened to me. We also went through and discovered that I hadn't been on a train for 10 years, hadn't been on a bus for 10 years. I drove my car, but I was living in a small bubble. There's probably lots of people who don't catch buses and trains, but anyway, I worked it out with my psychologist and psychiatrist why. So Jim's been really good. We've caught trains, which was a big deal. I've got my Opal card. So I can sort of talk to Jim, and he's sort of in between the medical help, which helps, and the fact we could spend time just having a coffee and just talking about things in general. He shares a bit about his life, and it started to help me to share about mine.
My name's Jim, I'm a peer worker with the PICS program here in Sydney. I grew up in Sydney, went to university in Brisbane, did an arts degree in psychology up there, and that was after I was first diagnosed with schizophrenia, and I had anxiety and depression as well. So I've been dealing with that for the last 21 years and been managing okay with it. I've worked in banks, I've worked in call centres, and I fell into this job, this peer worker role, and I absolutely loved it. I like the fact that I wake up every day and I'm going to help someone. And more than likely, if it's an average day, I'm going to help 4 people. So that's an opportunity for me. I like being on the front line, and I've got my own lived experience. So I'm living with that, and I'm using that. It's helping me, and it's helping those that I support.